As a nursing TA for fundamentals, there are a couple of things that trip up a lot of new nursing students, especially in fundamentals. The ABCs of nursing obviously is talked a lot about in nursing school and for the NCLEX, but you also have to think about all of the safety implications for yourself and your patient because the NCLEX is going to ask you a lot of those questions, and so you will see a lot of those questions in your nursing exams. One of the things that I think is very high priority for you to know is the modes of transmission and the type of diseases, right? So airborne, contact, droplet. Of course, it's up to you to memorize that, learn that, really familiarize yourself with what those are and what diseases are which mode of transmission. Let's go over a question, just one, so you can see kind of how that is applied in an NCLEX style question. Let's say there is a patient that has tuberculosis or TB that needs to be transported to radiology. What is your priority action? Priority action is the most common type of question on the NCLEX. So A, does the nurse have to wear an N95 mask? B, put a surgical mask on the patient. C, notify the radiology that they have to be in a negative air pressure room. Or D, don't do any sort of PPE because it's going to be a delay of care. Which is your answer? The answer is B, the patient wears a surgical mask. Because when there are airborne precautions, you need to put a mask on the patient during transport, and it's usually a surgical mask. It is not an N95 mask. I know if you're just memorizing the chart and you're thinking airborne, PPE is N95, think about modes of transmission and modes of transportation. If the nurse is the one moving into the space, they wear the N95 mask. If the patient is moving out of their space, they wear a surgical mask. Okay, so yes, while the nurse should wear an N95 mask if they are entering the room, if they are exiting the room, the patient is the one that has to wear PPE in the form of a surgical mask. This is why it's so important for you to learn how to apply the information, not just memorize the content.